Hi everybody, I'm Andrew Bennett, one of the CEN clinical faculty in Texas. I am going to be walking you through the lower quarter screening module this week. Wanted to take a second and just talk with you a little bit about why we're using this lower quarter screening flashcard approach, maybe to give you a little bit of understanding that may motivate you to actually learn it rather than just memorize it and kind of get it done. The lower quarter screening is a standardized way to look at all the patients that will come into your clinic with lower quarter problems, hip pain, neck pain, hip pain, low back pain, or even ankle pain. The lower quarter exam is very, very specific. What I'm hoping that you'll do is you'll learn this process so that we can be consistent from practitioner to practitioner, intern to intern, but also because it's going to give you a ritualistic way to complete a physical exam every single time you touch the patient. There's something very special and sacred about the ritual of the physical exam. The TED Talk that's linked in the resources will go into further detail. So if you haven't seen that yet, I'd recommend you do that. Now, the lower quarter exam serves several purposes. Number one, it's complete. It gives you a good basic platform to start from. It's organized by body position, so it's efficient. So we'll do, in PT school, we often learned by region, like we learned a hip exam and the knee exam, depending on what we were working on. Well, in the clinic, we don't function that way. So it's organized for efficiency. So we'll do a seated portion. We'll do obviously a standing portion, a seated portion. We'll do a supine portion, and then a prone portion of the lower quarter exam. It's done that way to make it fast for you so that you can move from one region right into the next. The other thing that this lower quarter exam is going to do is it's going to help you refine your hand placements. When I mean hand placements, I mean your body position, your hand placement on the patient's body, as well as your communication hands. How well can you communicate to your patient that you'd like them to move a certain way? How well can you communicate with your hands to your patient that you felt that they've encountered pain, or that you feel some stiffness here as well as this area is beginning to become painful, or that this isn't painful at all. So the lower quarter exam will help you have the framework to begin to grow into that level of clinical exam. And finally, the portion of the clinical exam is really for thoroughness. If a patient has knee pain, you're going to do this basic lumbar exam and hip exam in the idea that if there is any impairment or anything in the hip or lumbar spine that may be associated with that patient's knee pain, you'll be able to identify it. In other words, we're going to give the spine every opportunity to squeak. If there's anything going on in the knee during this front that's related to what's happening in the spine, we'll be able to identify it. So again, I don't want to make this more of an ordeal. There is a lot to learn here, a lot of motor skill. You're going to have to practice it. You're going to have to play the YouTube video in your car and listen to it on your commute. I would encourage you to print out the narrative Word document and post it on your mirror in the morning and actually practice it while in your head while you're kind of getting ready for the clinic. I would encourage you to say it out loud. This is a ritual. This is something I want you to be able to do without thinking. In other words, let's not spend our brain power trying to remember what we do next in the clinical exam. Let's spend our brain power listening to the patient. We know where to go next. Our brain is not required. We know how to pedal the pedals on the bike. We know it's left and right and left and right. Well, if that's happening in the exam room, then your mind is freed up to listen and to watch and to pick up on things that you might not otherwise see because you've been too preoccupied with, well, when do I need to look at the hip and do I need to look at the knee now? So spend some time learning these. They are going to be labor intensive, but that's why we put them up front. So you'll have some time to learn the lower quarter this week, and then the upper quarter will come next week. Again, the goal is that you will be independent with these, maybe not perfect, but independent with these within a week's time, and have your clinical faculty really work with you in the clinic and work with your intern peers. Be sure to use the discussion board to ask any questions, or if there are some concerns, just let me know and I'll be happy to address them. Thanks a bunch, and looking forward to next week when we meet again on the upper quarter.